Hey y'all, my name is Joy. I am a general dentist, and if you're new here, then you don't know what I've been up to, okay? I was a dental student when I started this YouTube channel, and I would give advice, tips, tricks about how to get into dental school yourself, how to get through dental school, and yes, so now that I'm a dentist, I'm like, if y'all are in dental school, sorry, it's already too late, you're in. It's not a terrible career, but there are ways to make it better, and I'm working on figuring out how that is. When I first started practicing dentistry and I was still continuing this channel, I was just talking about like things that I can do to help me continue being a dentist because it's tough. Okay, so a lot of self-care, being able to kind of disconnect from the job. Like when I leave work, I'm not at work, y'all. And I think that's important no matter what your career is, but especially in this career, like it can be heavy, it can be a lot, and you need a break. You deserve that. Also, I think specialists get treated much better than general dentists. Now, if you're a specialist and you disagree with this statement, fine, I respect your opinion. But from where I stand in these general dentist shoes, yeah. So what I am looking forward to next, I don't want to go to residency. I don't think that would work very well with my lifestyle right now. But I do want to expand my horizons and learn different areas of dentistry and see what can happen. So right now I'm really interested in sleep medicine. Sleep medicine is something that we didn't really learn about in school. If we did, it couldn't have been more than like one PowerPoint for like 1 hour of a 3-hour lecture. Y'all know how it goes. But the thing about sleep medicine is that the majority of people, not majority, but like a lot of the population suffers from sleep disturbances due to airway issues. We don't have enough space here. And so there are ways that we can correct that. And I am finally ready to dive in head first. This week I'm going to a conference in Tampa. It is the North American Dental Sleep Medicine, North American. I don't know. I'm gonna figure it out and I'll let y'all know. It's like NA. And it's going to be a series of lectures from people who are full-time sleep dentists. Like they don't drill, they don't fill. They treat oral sleep apnea, or they treat obstructive sleep apnea with oral devices and myotherapy, all different types of clinical tools that we have in order to fix this issue. I'm actually going to this one conference because my professor, she was adjunct faculty. I think she still is in San Antonio. But I saw her on the lineup for the speakers and I was like, yeah, I'm gonna go hear you speak. I'm gonna go ask you some questions and we can chit chat about it. So I'm excited to see her. I did not reach out to her. I don't have any contact information for this doctor. She's really cool though. And I always liked her when I was in school. And I didn't like a lot of the faculty. So thanks for my degree, but like no thank you to everything else. And my friends, them too. But everything else, y'all can keep it. So I'm gonna go to this conference, see what I can learn, see what else, what ways I can be pointed, because from what I have researched, the Vivos course, so Vivos is a company, they make oral devices. So devices that treat oral. They make devices that treat obstructive sleep apnea. And there are a lot of things to do when it comes to that because you have to go through medical billing, you have to get a diagnosis from an MD, and you need to do sleep studies, all these different things in order for the patient to be qualified by their insurance to even receive this type of treatment. And so Vivos is a company, they make the devices, but also they teach the courses on how to use their devices and how to implement it into your office. And then there's also the, there is another organization, it's like the organization about sleep medicine, and they have their own course too. So I want to go hear what these people have to say and see what is recommended from the people who have been doing it for, 5 years, 10 years, 20 even. And it's crazy that like we didn't learn about this because when you think about it, the roof of the mouth is the floor of the nasal cavity. And so if the roof of the mouth is high and arched, we don't have a lot of room in the top for air to flow and for us to breathe, which causes snoring, which is not normal. Snoring is not normal. And it causes all these other things. So like mouth breathing, which is bad for us, And when we mouth breathe, we're not keeping our mouth closed, obviously, which means the saliva is kind of evaporating. Our teeth are not being properly treated with the saliva in our mouths. Like, saliva is there to protect us and to prevent cavities. And so there's so many different full body problems, but definitely oral problems that can come from not enough space up here. So I'm excited to see how I can incorporate that into my practice. I also feel like it's on brand for me. So as somebody who really likes yoga, breath work, holistic types of wellness, sleep medicine and airway dentistry, like, it seems they go hand in hand. So I'm excited to see where this leads and to kind of take y'all with me on this journey. So hopefully this is interesting to y'all. Follow along with me and let's see what we can learn. Thanks for watching. Don't forget to like, subscribe, and share with a friend if you think they might be interested. Until then, bye y'all.